Congressman, thanks for joining us this morning. I want to start with some news of the day, and obviously coronavirus is the big issue of the day. The president announced this morning that he's going to have a press conference at 6 p.m. tonight. Senator Schumer has indicated that the request should be higher. He's asking for $8.5 billion. The president has asked for $2.5 billion. You remember the Appropriations Committee? What do you think is going to happen? What is Congress going to do to deal with this possible pandemic?
Well, first off, I appreciate the fact that they're taking some responsible steps towards trying to contain and get out in front of this as best we can. And it's going to require funding, obviously. I think the $2.5 billion, it sounds maybe like not enough, but the one thing I found when I first got here, we had the Hurricane Sandy, and all of a sudden we had to give $60 billion. Yeah, I'm more of a fan of incremental growth. I mean, we'll give $2.5 billion now, and I think if it's determination later that you need to get to $8 billion, that's what it's going to take. But Congress can act on its feet, and I think it's important that we act on our feet and deal with this deliberately and make sure that we take care of and address the situation as quickly and as responsibly as possible.
Do you think something could be, some type of emergency spending bill could be signed into law relatively quickly?
Yes. I mean, that's one thing. We do tend to work on deadlines pretty well.
Right. Got to set them. Right.
For whatever reason, we seem to have more profound thoughts on December 21st about the budgeting process than we do the rest of the year.
Right.
But that's unfortunate, and that's our fault. We should do better than this.
On opioids, I was looking it up, and 2 years ago to this month, you and I sat down to talk about this issue. Can you give us an update on progress made and where progress has to still be made on opioids, specifically your district? I know you're part of the task force. You're having town halls on this issue all the time.
Well, 20 million people wake up every day addicted. So in this country, and that cuts across every social, economic, even districts. And how I got started, for those of you who weren't here 2 years ago, I haven't been a prosecutor for 25 years before I got here. We sat down, we have a little bipartisan group of Susan Brooks, myself, Joe Kennedy, and Kathleen Rice, former prosecutor, or recovering prosecutors, as we like to call ourselves. And we first sat down trying to think where we could have the most impact. And as you went around the table, there's probably 20 of us in the room. Opioids was the one common denominator to everybody's district. So we tasked ourselves with let's go back to our districts and find out what the problems are, and two, what's working. And from prosecuting the days of old, we watched whether it was cocaine, crack, meth, LSD, everything sort of worked in waves, right? It came in and it worked out, and then something else became fashionable, if you will. And we sort of arrested our way out of those things. And this is something that's completely different. We noticed that it no longer is, say, like with the alcohol or the other addictions, where 28 days alone in a rehab center and you walk out, and people can get back on their feet and usually reintegrate, and you didn't have the recidivism rates we were having as we were with opioids. And so and just last week at home, I go around to all these different community centers and the police departments and sheriff's departments and ask, what's working, what hasn't worked, how can we be better, where can we push more money? And the one thing you'll notice that's a common denominator now is the fact that this is not something that's 28 days. This is maybe 9 months to 2 years. And we really need to extend our programs and help facilitate that change in actual lifestyle, because returning people to where they came without employment tends to put them right back in the situation that got us there in the first place. I tend to see this as something it didn't just happen. Like when I left to come here, and I got elected in 12, so I started to see heroin and opioids were a problem, then heroin really in 10 and moving on. But it was one of those things that I really think the opioid problem started more in the 80s and 90s, whenever we introduced those silly smiley faces as to pain management. And so we gave reimbursements to doctors and hospitals based upon people being happy. So it was a hell of a lot easier to make people happy and give them the prescription they were requesting. And I know from my times as a prosecutor, it was awfully hard to break that doctor-patient relationship, because if the doctor was really somebody dealing in this business, you strip a person down, they can't wear a wire. And so you really weren't being able to break that. So what we did is start following the people after they were getting their script. Even though this is an all-cash business with the doc, right? We'd start following them to where they were getting it filled. And then, went after the pharmacies and tried to tighten up that way and did it. But, again, it's now, they were still finding the opioids, and they were still finding, unfortunately, then the heroin that came into town that was even cheaper. And the bad part, while in Ohio, we were at ground zero, the number of deaths from overdoses has come down, thank God. All these task forces are telling me meth is coming right back in its stead. And it's coming in stronger and unfortunately as cheap as it was, as heroin was when it first got here. So, and it's also getting cut with the fentanyl, which is horrible. So while we've made some strides in what we're doing, I don't think we're out of the woods yet. Mm-hmm. We need to continue to fight and provide funding into those areas that work and change the ideas that, but for this addiction, these are productive members of society who are unfortunately in the grip of the devil itself.
Speaking of resources, you've introduced the COPE Act, which, looking at the co-sponsors, really conservatives and liberals on this bill. Can you tell us a little bit about the legislation and where it goes from here? Now it's at the Judiciary Committee. Mm-hmm. Do you think that could move sometime this year?
I hope so. I mean, the idea that we could provide Narcan, to be able to provide that for first responders and make it available. And you get a lot of pushback when you say, well, you need to have it available in schools. You need to make it available to kids so they can help their parents. Just to make it available so first responders have the ability to use it and have that at the ready. And one of the discussions I had last week, I mean, every thanks to the local hospital, every police department, every squad car, they've got at least one in the car. The schools have now had it, and making sure that it's available and that first responders are properly trained in how to do it. And it's truly a shame that we have to teach school children how to do it or administer it to their parents or to the individual, the guardian, whoever they're with. But it's something, unfortunately, that's needed, and it's something that we're going to continue to do. And, I'm not going to lie to you, there was some pushback when I first started bringing up these ideas of bringing Narcan from some folks be like, well, these people have done it to themselves. I mean, it's a disease. And nobody asked for this disease. Unfortunately, they got the disease just like they had cancer. And we try to cure cancer. We try to prevent these things. We need to do the same thing when it comes to this type of addiction.
Have you seen improvement on specifically that attitude, the stigma mm-hmm. of it? Because there has been a lot more education on the disease. Has that gotten better? Have you heard less of that, well, he did it to himself kind of thing?
Right. Well, one of the things I give credit to Facebook. They put out this thing about Stop Opioid Silence that I partook in, as well as a lot of other members of Congress, where you talk about get on, and they did little public service announcements basically, but these PSAs were about stop the silence, share your stories, and the idea that you're not alone, and to come out of the woodwork and you don't want to admit that that's an issue, but get involved and get your communities involved, because it's something that we all have to do together to help these folks get through this and realize that, like the drug courts we have, to give you an idea, one of the great things they're doing is they're testing these individuals as they're coming out on a bi-weekly basis. So for employers, what better thing to know than that your employees being tested on a bi-weekly basis, and you're not going to have this problem because that's a concern to them, obviously. And trying to get employers and communities to understand that, these are good, honest, productive citizens, but for this problem that they're going through, and working together, we can get them to that next stage and get them back to where they started from.
We're in election year, very polarizing time, and I know this issue has, yeah, check out the debate last night, where opioids did not come up. But this has been a lot of members that we've had at events like these. They've said, despite all that, despite the election year, the polarizing times, can you describe a little bit of how this has fostered relationships across the aisle, which is so rare nowadays?
Sure. And with all due respect to the media, if you went down into the locker room like this morning and you saw everybody working out and giving each other grief, you have no idea who's a Democrat or who's a Republican. We're all overweight, aging athletes who are trying to trying to stay in a semblance of shape.
Never give up, right?
Quality eventually. That's our motto. And so a lot of times it gets fostered that we really don't work together. But there are, as I tell folks at home, there's 435 members here who love their country and want to see the right things happen. We just might happen to see the solutions from a different lens. And so it's important. The one thing that I found in my time here in short commodity is the ability to listen. So if you listen to people and you listen to their stories or the problems that they're having at home, and then you can explain to them, well, here's some of the things that we're trying to get done with the opioid crisis. And I realize you don't like to spend money, but we're going to spend this money. And wouldn't it be better to spend this money in a targeted way that actually helps people or gets people to where they need to go? And having the buy-in, the solutions that way, I think is getting us a lot farther. And there's a lot of people who, again, no matter where you're coming from, it's happening in your district. All of us in this room probably know somebody who's been touched by it. Lost a nephew to an overdose that was fentanyl-based. My kids have lost friends, unfortunately, to overdoses. It's a sad reality that hits all 435 districts, all 50 states. And we've lost more people than we have the Vietnam War. And we need to address it, I think, in similar tactics. So you get buy-in from folks if you can at least get them to sit down and whatever the area they have some concerns and address their concerns and have them get buy-in to, like, this is a big program. It's a multi-step program, and we need to have you all in and getting it done. And I've not felt much resistance. Initially there was some, but more and more people now when they go home saying, ask your local sheriff about it, ask your local EMS people, get them aside, go up to the hospital and ask what their biggest increase in emergency room visitations are. And then all of a sudden they come back and they have changed attitude towards the need for help and the need we all need to work together to get this accomplished.
We're going to open it up for questions in just a couple minutes. As far as you mentioned obstacles and pushback, have you seen better coordination between the feds and local communities and providers and the healthcare communities? Is that the reason why there has been some progress here?
Yes, and there's even been progress between the House and the Senate.
That's rare. Yeah.
Bicameral progress. No, it's one of those things where you talk about, well, we're going to pass this in the House, but that's only halfway home, right? We got to get it through the Senate. There's buy-in on both sides. There's buy-in, bicameral, bipartisan support here. And that's strong when you go back home and you talk to the hospitals and folks that saying that this is an all-in approach. We're all in D.C. We need you all in here. And I don't come telling you what the answers are. You tell me what's working. And then we come back and work on how we can get the appropriate, let's face it, financing to those problems for you and for the longer-term recovery, to the Narcan, to one of the things you want to do is someone who finally admits, it's got me, I need help. Get that person to where the help they need. You can't tell them come back in 3 weeks, because they'll probably be dead. So you need to have ways that we can bring the help to them right then and there. And getting the communities, the hospital systems, like say, providing Narcan, that wasn't necessarily heard of a few years ago, but now all of a sudden to make it available and to do the necessary training so it's available where it's critically needed, in schools, at colleges, in places where kids gather. That's an important part of the program. It's also getting people to buy into the fact that if you see people buying or gathering, give an idea, there's a local 24-hour gas station spot. And all of a sudden there'd be all these cars there at midnight. And one car would come in and they'd all meet by this one car and everybody would take off. Well, guess where the heroin just came from? So, you start to, and having people report that. The fact that there's a gathering and all of a sudden there shouldn't be a gathering necessarily at midnight, because it's not like they're gathering by the pumps. To report that stuff so that law enforcement can take it. You got to get that whole community approach to really make this work.
Got a few minutes left. We'll open up for audience questions. If you can wait for the mic and identify yourself and ask a quick question.
I'm Christopher Gable. I'm a pediatrician in Ohio, and I grew up in your district.
Okay.
What affects the adults affects the children even more. Neonatal abstinence syndrome is a huge issue, especially in Ohio. And
It's heartbreaking.
it's heartbreaking. And, So I wanted to hear a little bit more about your thoughts on how these kids are going to go through life, because we don't know, when they are born with this affliction, what their outcomes are like throughout their entire life. And as pediatricians, our job is to prevent this from happening. And then also, Medicaid doesn't have the payment parity of Medicare, so that reduces access. Representative Schreier will actually be submitting a bill tomorrow about Medicaid and Medicare parity. So I want to see if you could see your way to supporting that.
Well, thank you. I'm not going to tell you I know every bill that's being put forward, but I certainly appreciate the input and dutifully in the back taking notes for assistants of mine to make sure that I get a hold of that bill today and take a look at it. Our caucus generally passes bills back and forth among each other to help. As to the syndrome, I guess the most critical thing we do is stop the abuse of the people before they get to that point of being addicted and having babies that are born with it. That, going down to the neonatal care at UH and seeing what's taking place, man, I don't know a way to stop that. I sure like to find a way because it's a shame what's happening. And unfortunately, these are sort of like, I hate to admit it, but almost test cases with these babies now because we'll see how it carries out. Hopefully it doesn't lead to them becoming addicts or having these problems, and rely on folks like yourself. I mean, I'm 25 years in law enforcement. I'm pretty good in crime scenes and courtroom procedure, but I rely on folks like you to tell me what's working and what's not working. And so that's why you got to grab. You don't live in the district anymore, but feel free to reach out in whatever district you're in. All of you, reach out to the folks that are representing you and say, these are critical concerns we have, and how are we going to address them? Because that's what helps. And then trying to get the funding to do the studies that are necessary to be able to help you and help your colleagues help these kids.
Another question from the audience?
How about those Browns?
Good morning. Thank you again for speaking to us today. My name's Gautam Chabrolu, like Gotham. And yeah, founder of Believe, a digital health company that helps doctors, all the pediatricians, internal medicine over here, prevent opioid abuse and addiction. But really my main question was, you said that Ohio was the ground zero, and we see other states like West Virginia very hard hit. And my question to you, we hear a lot of answers, but why, in your perspective, was Ohio such a ground zero? Like, why wasn't it in any other state? Thank you.
Boy, I wish I knew the exact answer, but I'll give you what I've looked at. I think combination of unemployment, people wanting a way out, and unfortunately this was getting where they needed to go. The overdose, the idea that the opioid epidemic was getting bigger and bigger, and more people were getting involved in that. And then all of a sudden, it was getting to like $1 a milligram, and 80 milligram OxyContin was $80 on the street. And then riding in right behind that was cheaper heroin, with allegedly the same effects. And then in-road fentanyl right behind that. And fentanyl, that you know better than I do, but my understanding was like last stage cancer patients helping them breathe. And so part of the problem was that you're relying on folks who are dealing street drugs to be putting together this mix, cutting the heroin with fentanyl, and then putting it out there. And just to give you an idea, one day when we were just starting our drug task force, court drug task force, and I'm walking back down the street in Chardon, Ohio, where I was a prosecutor. This lady's coming at me, and I know we just sentenced her son that morning for third time he got caught with heroin. And I figured this is gonna go well, right? And the lady's like, "Thank you." I said, "Pardon?" She said, "Thank you. At least I know my son's alive." And I said, "Well, your son wasn't showing up on pawn sheets or burglaries, the normal places you'd see kids who are addicted." And she said, "Oh no, by week, well-to-do family. They'd been on a vacation in Europe in the summer. He was going to Miami University. He started jaking when he was over there. Admitted to his parents he had an issue. They came home, got him treatment. It hadn't worked. The usual cycle that they were going through. But he was working as an apprentice for an electrician." And so every weekend, he'd get his check, and then he'd buy. And he would do what he did last Sunday. But the trouble is, as we all know, today's mix wasn't last Sunday's mix, and he'd be overdosed. So 3 times you find your kid on the verge of death. We need to break that cycle. And so we've taken aggressive steps in working with the physicians about stop prescribing opioids, or at least not to the extent that they were with so many refills. And I know that they administered different ways of going about it and making urine tests for those who are on a sustained level of opioids for pain relief, that they have to be subjected to those. And if they have anything else in their urine, they're cut off from getting the opioids again. And then enlightening the pharmacists when they see the problems or see something that they see as a problem, to also go about reporting it. And the doctors have been very good about that. I mean, they had 4 years of med school, 4 years of residency, but during that time they had 4 hours in pain management. It wasn't necessarily conducive to explaining to them the addiction or the power of the addiction of opioids. So, all these steps are taking place, and so it's nice to see that the opioid and the overdose deaths are coming down. So I think we're having an impact, but I don't think by any means we're out of the woods.
Thank you.
Thanks, Congressman, for joining us. Please thank the Congressman for joining us this morning.